Well, back with Dr. Adami. Dr. Adami, tell me, we talked about missing teeth and the havoc they can cause. I mean, I definitely was surprised about the, taking years off your look because of fixing them. So
Sure.
what are some of the options, the 2, 3, or 4 major options which are out there? Give us the pros and cons on each one of them a little bit, just as an overview, and we're going to
Sure.
get into the more specifics of each of them in a separate section.
Well, that's great. There are basically 3 ways to replace missing teeth. The first way is the old-fashioned way with something that's removable. It's a removable denture, and it clips onto your existing teeth, and you take it out and you put it in a glass by your bedside. Not the most desirable way to do it, but certainly an option. The next level up from that would be something
Let me ask you
called
about this one. When you do the removable one, since you're not stabilizing, not putting any material like any iron rods into the bones, is that still because of that? Can your bones, your arches still shrink and you still start looking caved in?
Yes, you can still, and you still do. The bones shrink at about 1 millimeter per year, regardless if you wear a denture or not. So the partial dentures do not stabilize the bone at all. They just help you to chew.
Okay. And the next option?
The next option is something called a bridge. If you have teeth on either side of the space, you can place crowns on those teeth, and then you basically solder a dummy tooth between the 2 crowns. So if you've got Brooklyn and you've got Manhattan, and you basically make a bridge right across it, and those teeth chew for you. That's a major advantage because those teeth glue in and they stay in. They don't move around. They also support the bone. I'm sorry. Damn it.
That's all right.
Let me get this outside the room. I forgot that was in the room. I apologize.
That's all right. Continue. We'll cut it out.
Okay. So basically, if you have Brooklyn and you have Manhattan and you form a bridge across them, the teeth on the bridge can chew for you. That's a major advantage because those teeth glue in and they stay really tight. They don't move around. It's probably the next best thing to what you had in there before you lost the teeth. It also helps the bone stay nice and high and tight so you don't sink in and look like an old dried-up tomato. So that's the second way. The third way would be if you have very few teeth and you don't have Brooklyn or Manhattan to make the bridge onto, you basically put what's called an implant into the bone. And an implant is basically a soda can-shaped cylinder that gets placed under the gum line onto which we can actually screw a tooth. And you can even put a few of them in and screw a bridge on. That is by far the most desirable way today, and it is really the current state of the art in dentistry today.
Okay. And that one starts supporting the bones also because instead of the original root, there's a metal in it and the bone cannot shrink.
That's correct. The bone level does stay nice and high, and it prevents you from losing facial dimension, and it prevents things from shrinking in and basically caving in over time.
Okay. Now, I also have heard, of course, lots of people putting an implant in it only just for one tooth, even though there is Brooklyn and Manhattan available. What advantage would that have, if at all?
Well, the advantage to that is that you don't need to reshape the teeth on either side of the space. One of the downsides about making a conventional bridge is that you need to basically remove all of the outer enamel, or all of the outer layer of the 2 anchor teeth. And sometimes that can lead to root canal, that can lead to sensitivity of those teeth. You can still get cavities on those teeth. So it's not 100% fail-safe, and oftentimes those bridges need to be remade over 7 or 10 or 12 years, whereas an implant bridge is a lifelong solution to your problem.
Interesting. And also, since you mentioned about you can get all kinds of little cavities under the bridge and stuff, there's also the fact, I guess, about flossing. Once you have a bridge, you have like 3 teeth. You cannot really floss that part of the gum, and that in itself might, it's one can floss it, but it's much more difficult. You have to go and with a needle stick through it, and anything to that at all that you can get more gum disease in that area?
There is a lot to that. Although the bridges are made so you can clean underneath them, it does take some dexterity and it does take some diligence. You need to do more than just brush. There are many devices that we can instruct patients to use to clean under the bridges, but that has to be done, and it's sometimes a bit of a hassle. Whereas implants, basically, you just treat them as your natural teeth, and you can floss the way you normally would, and you brush them the way you normally would. They don't take any special care the way bridges do.
Well, a little bit of hassle sometimes, to you doctors, and, you're well educated in those things, a little bit of hassle, what it means to us usually is we don't do it.
That's exactly right.
Kind of like...
That's very true.
Yeah, it's a little bit of hassle to walk out of my bedroom to the other room to the exercise machine and bang. If I don't move it into my bedroom, I don't do it. And,
that's very true.
Even then, without my wife sitting there and telling me to do it, I won't, again, there's that saying, and obviously your dentists are not next to us on a daily basis, tell us what to do. So I guess making it as normal and comfortable and as easy as possible is a big part of it, right?
That is quite right. It does take some discipline to maintain a bridge and to maintain proper oral health. There's no question about it. And people in general tend to slack off a little bit with the bridges, and you wind up with some gum, and the gums get red and can bleed easily, and it can really decrease the lifetime of the bridge. Whereas implants, although you, of course, are supposed to keep those clean as well, they're less prone to having problems if you leave a little bit of food debris on them, and not the end of the world.
Well, all right. Well, thanks again, Dr. Adami. We'll speak to you soon again for some other topics.
Very well. Thank you.